Hello everybody. The last video, or one of the more recent videos we just released, was Brooke, who came here from Florida. Because Brooke had been having problems for how many years?
4 years.
And been to how many doctors?
6, 7.
6, 7. 2 orthopedic surgeons who, what did they do?
They didn't even touch my shoulder ever, neither of them. They looked at the x-rays. They said your bones are broken, so here's some steroids to help with the pain.
So they treated the pain.
Mm-hmm.
Then you went to how many chiropractors?
Probably just 2.
2 other
Yeah.
2 chiropractors. And what did they do?
Everything but my shoulder. Mostly it was just like cracking my back and.
How long did it take for a treatment? A minute or so?
Yeah, it was quick.
It was quick.
Yeah.
I see. So here we are. You've had 2 treatments, right?
Mm-hmm.
You've had this for 4 years. You're here today, and we've never done this before, had the patient come back 2 or 3 days later. With the problem for 4 years, orthopedic surgeon, 2 chiropractors, 4 years at wit's end. And it was pain in your neck down your arm, correct?
Mm-hmm.
All right. But the orthopedic surgeon, did he have you take your shirt off or anything?
Nothing.
No. He says, yeah, get an x-ray, fine, you're okay, take some pills. He's treating symptoms. Aren't you tired, American people, national people, international human beings? Aren't you tired of people treating your symptoms and not eliminating the cause? There are more effective and intellectual and very effective ways of doing this. All right? Then you go to the chiropractor. Did he take x-rays?
One of them did.
One took x-rays, and you had those x-rays and showed them to other chiropractors. Mm-hmm. Did they then want to restore the curve in your neck, or what did they?
Yeah. The orthopedic surgeon was the only one who talked about my neck being kind of straight, and he pointed it out. He also said that my shoulder pain. He said a lot of times shoulder pain is caused actually from something in your neck, and that was all he said about it. And then he just gave me pills.
So the shoulder pain may be caused from something in your neck. Okay, so you went to the chiropractors, and you obviously had some very good adjustments. Or did he give you relief?
No, not really. Not in my shoulder. I have I always have low back pain, so like that got a little bit better, but the shoulder was kind of.
So the reason we talk about this is we're making this video, and it isn't about please come see me. I get one call a day from all you wonderful people about Dr. V. Is there anybody in St. Louis? Is there anybody in Albuquerque, New Mexico? Is there any kind of GPA chiropractor in somewhere where I can go see? I don't know of many. We have maybe 15 certified GPA chiropractors now. They'll be on the website, the Chiro Guru. There's 9,000 subscribers and there's close to 3 million views. This is not about me wanting you to come see me. This is not about that. Okay, we're plenty busy here, and after 45 years of practice, we're fine. I started making these videos to try to show chiropractors that I know you do adjustments, but what is your goal? Is your goal to treat the symptoms as a result of the adjustment, to take away that pain, or is your goal to use the various techniques you know to have a goal of upright balance of the spine from the feet, pelvis, head? Bipedism, gravity, upright. GPA, gravitational pattern alignment, teaches you the adjustments as well as how to achieve your goal as balance from the feet to the top of the head. This is what I do. This is what you should encourage your chiropractor to do. So if all you people that are watching this, hey, Dr. V has a good point. I'm going to go to my chiropractor and say, look, do this or I'm going to find somebody else. Because this really helps. Use gravitational pattern alignment. It can change the way chiropractors do chiropractic. It could be such a benefit in the chiropractic profession and community where we're actually trying to achieve a goal rather than randomly popping and adjusting vertebra that can be turned on or off. Okay, it's not about symptoms, it's about end result. What's the end result? Allowing the innate intelligence of the body to flow and heal. We have to take the restrictions and the impediments away from the spine, the vertebra, the neck, occiput, whatever is impeding them on the brain and spinal cord where life force and God's energy lives, and get that energy out to heal. So when you were in Friday for the first time, you had all this pain. I worked on you for the first 15 or 20 minutes. I didn't touch your neck, did I?
Right.
I didn't touch your shoulder, did I? But after I did all of this, before I touched your neck and shoulder, I had you stand up, and what did you experience?
It was better.
And before I even touched it, correct?
Right.
So by changing the balance at the pedal foundation, foot foundation, which then changes the articulation and the kinetic upward balance in the ankle, the knee, the hips, the pelvis, the spine, it rotated everything, actually shifted her occiput, rotated her shoulder girdle back, and did enough of movement to take pressure off of the brachial plexus nerve root. Mostly it was in the clavicle scapula, the first and second rib. It was a sort of a pseudo thoracic outlet syndrome. Minimal involvement in the neck. Now, you had second visit the next day. Okay, this is your third visit on this wonderful Monday morning in Colorado where it's 33 degrees and you're from Florida. All right? So, have you improved?
Yeah, a lot.
Tell them.
It's probably 85-90% better. There used to be just like constant searing pain underneath my shoulder blade. That was where it was the worst, and then up here. And the pain in my back under the shoulder blade is completely gone, like totally gone. Still a little tender up here, but the worst of it is totally gone.
And your life is back.
Yeah.
Patients, chiropractors, watch, listen. If somehow we can make this a movement where more chiropractors do this objective, systematic, undeniable, result-oriented as far as upright posture, balance, the better off we're going to be in our profession, because we will have a definition of what chiropractic adjustment does and what is a chiropractor. All right? Anybody can randomly go up and pop somebody's neck or back. Barbers used to do it. Okay? Is that what you want? Or do you want a bona fide, legitimate way of knowing exactly what vertebra to work on, what angle to adjust it, what order to adjust it, how deep to adjust it, and have the body respond to you so you know if your adjustment was accurate or not accurate based on the results that the body has. So, thank you for listening. We're going to now see her for the third time. 2 visits, 85-90% better after 4 years, 2 orthopedic surgeons, 2 chiropractors in misery. Thank you, God. All right. Have a stand up for me here and let me just see you. Turn around, please. So, face me. Back up a little bit, girl. All right, girl. Close your eyes. All right. Now, I have patients a little bit this way.
Which way?
Okay, she's standing in front of me. All right, have her open her eyes. People will position themselves and open their eyes and feel comfortable. It really doesn't kick in their imbalance. If you close your eyes, you get a little bit not as comfortable because you can't see, and so you'll position yourself more carefully. When she first came in, her front right foot was 3 inches in front of her left foot. It is now maybe 1/8 or 1/4 of an inch anterior. Okay, she had a dropped right arch, that is gone. She had a pronated right foot, that is gone. She had a low right shoulder that was, angle this way, the other way. She had a low right shoulder that was probably 1.5 inches low. You've seen it on the previous video. Now face me. That's gone. She had a high left ear, which is still there. So we still have occipital C1. All right. We had a mandible that did not line up with the nose, which means TMJ was out of alignment. And that's about 80% better. Her smile was much more. Did you notice that and looking in the mirror? Sort of. You don't look in the mirror enough, do you?
Okay.
All right, fine. All right. Now face the camera and let them see you.
Okay.
So I have a minimum Here's high. It was on the left side. Okay. Clavicle. Here's sternoclavicular joint. Oh, a touch high here. Okay. Left sternoclavicular joint, a bit anterior and protruding. So there's still some disrelationship or misalignment up here. First rib on the right bounces. First rib on the left bounces, but protruding. It's anterior, shifting anterior, and elevated. Okay, tender here. Second rib fixated. So basically everything, a lot has straightened out, but we have, and in the mid back, that's completely gone, right?
Yeah.
Okay, so the compensation has occurred all the way up to about our shoulder blade area. Now we're going to check again and do another fine tune and hope this lasts for a lifetime. Usually if I get people to a certain point, I could technically use 3 more visits, then put her on a monthly schedule and maintain her. Okay? To maintain the perfect alignment as possible, upright perfect alignment. Okay. And see how straight her face is? All right. Face down for me, ma'am. All right, let's come to the feet. Sorry.
It's so cold.
It's so cold. All right. Leg lengths, even. Achilles tendon on the right, about a 1/2 inch in thickness. Achilles tendon on the left, a 1/2 inch in thickness. If you recall the previous video, the right Achilles tendon was much thicker and flatter because navicular was dropped, calcaneus was shoved up, which stretches the tendon and flattens it as it comes over the calcaneus. All right? Dorsiflexion, dorsiflexion, symmetrical. Tender at all? No tenderness. Tender at all?
No.
No tenderness. Why is that important? You'll have an overdevelopment and an overusage on the side that is lower, or the short leg. All the body is shifting to the right. So this leg will work overtime. This gastrocnemius, soleus, all these muscles will work overtime. Okay, the Achilles tendon, okay, will be thicker, very tender because it's overworking. You athletes, okay, if you have the short leg on this side and you have a calcaneus up and a navicular drop and you're stressing right in here, you just check, lay on your back and see if you have a short leg. Ask your roommate or your mother or dad or whatever. If the leg is short, touch your Achilles tendon on this side. If it's real tender, right above it will be tender because that's where the tendon comes up and then it branches out and flares out and attaches to the muscle. A lot of tears occur in here. Okay, when you're this out of alignment with this tendon so taut and this muscle so stretched, you're going to tear something, much more likely to tear it when you're out of alignment. Do you want to do ice, heat? Well, that's treating symptoms. Do you want to do E-stim and use lasers? Yes, but you want to do dry needle? Yes, but that's treating symptoms. Correct the foot, pedal foundation, this corrects itself. The brain then says thank you, and it starts holding itself upright, okay, and it starts balancing out, and it starts being symmetrical like God expected it to be. All right, that takes care of that. Now let's bend both knees. So I bend both knees and it's symmetrical. Look how much more flexion you have. All right, before it was restricted on the left side because the pelvis was out of alignment. This leg was restricted the last video because this muscle, the quad muscle, was extended because its origin and insertion were shifted. So if the origin and insertion, the bony tuberosity, protuberance where the muscle inserts and originates, gets extended, that muscle has to extend and reach out to it. When the muscle reaches out to it, it becomes elongated. When you elongate it, it restricts the flexion because the muscle says, no, I'm tight, leave me alone. So what do? Do I go work on the quadriceps because it's stretched? Well, I can, but let me fix the cause first. Why is the quad hurting? Why is the quad overstretched? Why is the quad elongated? Why? Find out why. Be a detective. Amaze your patients. Give service to them they know the chiropractor in the area can give. And do what you're supposed to do. What God intended you to do would be heal people and do the best you can for them. All right? Pelvis, even. Ischium. You got maybe 1/8 of an inch. Okay? Even. Ischium low. Left ischium, maybe this elevated. What does that mean? That means the left hemipelvis is still shifted this way. And remember, we had just a touch of restriction here. Just a touch compared to the right. Yeah, just a touch. But they both go real far. So we have an ischium. Let's see. I don't think the pelvis is out, anterior pelvis. I'll test it. I'm going to put the wedge under the right belt line. Okay, flex both knees again. And no. So the anterior pelvis isn't an issue. That wedge says, no, I'm fine. I didn't change the range of motion. Put them down. Put them on the right side. Bend both knees. For sure not there. That makes it worse. And the hip rolls in. Okay? Now I wonder if I get the issue and just set it with an assisted drop. Assisted drop, I'm assisting. I sit on the table, push the table down, tighten my abs, protect my hand with my adjusting glove, sit and drop. Okay, I don't start and initiate it with my hand and break them or break me. Okay, ischiums. Even. So the hemipelvis was just a little shifted. I just brought it back. Let's check bilateral knee flexion. Well, now the left knee leg flexes more. Do you feel the difference there? Mm-hmm. Yeah. So immediately I balanced out the range of motion in knee flexion in the prone position by doing the hemipelvis. Not going through the old routine that I did before. Was it necessary? When you do the gravitational pattern alignment, the next visit you will see structural objective changes, not just symptomatic changes. All right? That means you did something and it held. It must change. If you did all the adjustments, did the GPA, and they come back worse, you did something wrong. If you did it right, the next visit, their structure is different. You're setting bones. All right, now let's go to L5. Tender? On a 1 to 5.
I like a 1.
A 1 at L5. We're going on 1 spinous process at L5. Tender. Not as swollen as it was the other day, but sitting a bit posterior from palpation. But we'll see. Let's go to L4. Anything?
Not really.
L3?
Mm-mm.
2?
No.
1, nothing, right? Okay. Now let's go to the 5th lumbar right transverse process. Anything?
So yeah, I like a 1.
1. Let's go to the transverse process on left L5. Anything?
Yeah, that's a little worse.
That's a 2-3.
Yeah.
So we have L5 involved. Okay. But she never really complained when she came here of low back problems because the neck arm problems were so bad she didn't care about the low back problems. So now when I worked on it the other day, she goes, yeah, I was having low back stuff too, but I'm paying attention to it. So she has L5 posterior on the left and shifting posterior on palpation. So now I can do a muscle test here. You muscle testing docs, just test them. I just don't always do them. So what we'll do L5 first. We put the wedge under the right anterior pelvis side. Do a scissors right at L5. Okay. Bring L5, rotating it. Rotate L5. Now let's go back Anything here? Any pain?
Mm-mm.
No pain?
Not really, no.
Nothing. It's different than the first time.
Mhm.
Okay, so I'm on the spinous process of L5. The sensitivity that was there before is gone. After I did the left posterior rotation with the scissors and shifted L5. Let's go to the transverse process. I tell you, that's gone. Correct?
Mhm.
Now, the reason I know that's gone is when I palpated this before, I felt the transverse process closer to the surface. It was prominent. I'm touching it now, and it's like the whole, positionally it's changed. Palpatorily, it's changed, and I can feel the change. All right? Let's check the leg lengths to make sure now, since I finished with the pelvis and L5, that the leg lengths are still even and the knee flexion is symmetrical. Leg lengths, even. Knee flexion, perfect. So, whoever you are, whether you're 2 years old, whether you're 90 years old, this is what I do. I correct from the feet to the knees, the pelvis, all the way up, so when you stand upright, you have the best, most perfect upright alignment you can possibly get. Am I healing her? No. Am I enabling her body, her nervous system, her spinal cord, the brain, and all the energies and everything to flow so she can heal herself? That's my goal. Yes. Allow what God put here to work to heal you. With Brooke, it's going to take 3 visits, and she's 90% better. That's not everybody. That's not everybody. Some take 1, some take 21. But the idea is if you just turn the power on, like chiropractors know how to do, in a more systematic, objective, goal-oriented way, this is what you can achieve. And this is necessary for the patients, and very much so for the chiropractic profession. Let's go up the spine. All right. L3, anything?
No.
L2?
Mm-mm.
1?
No.
T12?
No.
11?
No.
10?
Mm-mm.
9?
Mm-mm.
8? Now I think it's those vertebrae, so when I get to the distal tip of the scapula and I'm T8, I know I was right, because T8's right across, straight line across from the inferior tip of the scapula. Okay, 7.
A little bit.
I shook my head before she said that. There's where it starts again. That's where it was when she first came in. Makes sense, doesn't it? When you're dealing with shoulder girdles, when you're dealing with all these muscles and ribs attaching here, okay? Makes sense. So T7. Let's go to T6. T6?
Yeah.
T5?
Not as much.
I shook my head no. She said no. Here, nothing, right?
Mm-mm.
So, T5, 6. Better than it was. Hard muscle, hard muscle. That's the area. Okay? It's indented. It's soft on palpation. It's anterior. It's like an anteriority. It's got surrounded by muscles, spasms. Okay? And it's kind of hot. So if you feel the energy, it's inflamed here. Stomach. T4, T5. 6. Stomach area, intestines. All right? Wow. A lot better here, huh?
Mm-hmm. Yeah.
Well, this is interesting. And how about here?
It's still pretty sore up there.
So, where she had the first and second rib, scapula, and clavicle on this left side, but she feels it more now, T4, T5, T6. What would be the source? Well, if this is still the worst thing, and it's the last thing to go away, isn't it interesting that maybe it all could have started right here and worked its way up? Who knows? We won't know. It's not the point. The point is this is up the chain, so I have to fix it. So it's anterior. Lay on your back for me, please. And again, you can muscle test, guys, and ladies and gentlemen, doctors. I do this so much. I only do the muscle testing to try to prove something to you. I don't do it routinely. All right, so let's go to T5, T6. I use the protruding portion of the glove. I go below T5, T6, drop it. Oh, Oh, what? It was what?
It was a good one.
What?
A good one.
So I went to T7, T8. Okay? And I lifted her and came down. Now I didn't jump on her. I pushed, but I pushed up. Lift up again. So it's down, but up. 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 You're giving an adjustment. That's a hard adjustment to do, but it should be easy. Too many times you bring them up too high and you stretch their, you accentuate their kyphosis and it hurts too much. You can't do it. Let them go. Feel them relax. Like you do in the neck. When you go to do the neck, let the head and the neck, let the vertebra tell you when to adjust. Okay, you'll be feeling it and feeling it and feeling that neck, and the vertebra will loosen. Then you do it. All right, now come on up. Face down. And I hear your husband might be a chiropractor now, huh? No answer. Scoot down this way. All right. Let's start at T8. This is my landmark. T8, anything?
No.
T7?
Mm-mm.
T6?
No.
Come on. T5?
Not really.
T4?
Mm-mm.
T3? T2? Nothing. So, I was successful at laying her supine and adjusting below it with the supine adjustment with arms crossed on the chest. General adjustment, but can be very specific if you know exactly what you want to do. So now let's take the rib heads. How about here?
Not really.
Minimal, right?
Yeah.
Rib heads.
Yeah, that's kind of tender.
Kind of tender. Interesting. That's what your body tells me. So she has convex, she has rib heads coming elevated here, which means right here, her spine is convex. No, I didn't take an x-ray, not necessary. All right, so I want to fix the convexity there. So sit and face me over here. And that was left side, right?
Yeah, left side.
Once they sit up, and I get all confused here. Okay, right, left. So it would be right in here, correct?
Yeah.
Yeah, all right. You may have this right here. So we do our nice rib adjustment. Okay, clicked right in, didn't it? Okay, face down. Gee, doc, how do these vertebrae just click right in? When the vertebra, it's all related. So when the vertebra up here looks down and saying, hey, foot, quit doing that because you're throwing me out of alignment. Then I start working on the feet. The vertebra says, I'm next. Oh boy, here it comes. He's going to do the knee. He's going to do the hips, pelvis. I'm next. So when you get to T4, T5 and ribs, it's ready to go. This is a tough area to adjust. Simple little rib adjustment. Boom. Now, gone. Correct? Mm-hmm. And you can feel the ribs softened, bouncing, and more equal, not as anterior. Does she need a little more work here? Yeah. Will it be enough to cause all these symptoms to come back again? No. She'll be fixed, 90%. Sit up with your back to me, please. All right. Now, it was her neck, 4 years, unrelenting pain, neck, shoulder, down. Okay, to her arm. Shoulder. Sternoclavicular joint. This was about an inch before. Even. Palpation of the left SC joint, a bit prominent or anterior here, which means she still has a little bit of compensation problems on this left side. We understand that. Why is that left sternoclavicular joint pushing forward and prominent? Because the first and second rib is making it be that way. Because the first and second rib, T1, T2, has rotated because it's the shoulder girdle. All you people going to have shoulder surgeries, please, labral tears, for whatever reason. We had an athlete come in here the other day, professional athlete, comes in, Doc, they told me I have biceps tendonitis. And I look, and I says, oh yes, you do at least have biceps tendonitis. Obviously he has structural misalignment. It was a mess. No strength, no nothing. Left sternoclavicular joint in this particular athlete was up 1.5 inches. Now, that joint doesn't move that much. So all this shifting had to occur. And he had no strength in his arms. They said shoulder, biceps tendonitis. How about shoulder girdle? Shoulder girdle. All you people are going to have shoulder surgery? All you people are going to have new hips put in? Okay? The shoulder girdle shifts. The head of the humerus comes up and articulates into the shoulder girdle. Why would you put in a new humerus? Why would you do a labral construction? Why would you do any shoulder anything if your shoulder girdle in surgery, if your shoulder girdle's out of alignment, so the housing where the head of the humerus sits is wrong? It's going to be it's a failed syndrome. It'll be another failed syndrome. More importantly, hips, weight bearing. You got a bad hip wore out. Why did one hip wear out? Well, I don't know, I used to be a runner. Why did one hip wear out and not the other? Then the other one will also, but because the pelvis is out of alignment. The acetabulum, and the head of the femur comes in the acetabulum. Change the acetabulums, head of the femur, what are you doing here? Okay, but it still has to function. So the imbalance in the shoulder girdle, the imbalance in the acetabulum, in the pelvis, pubic symphysis, hemipelvisis, that screws up your hip. Get aligned before you have a new shoulder or surgery on your shoulder. Get your pelvis aligned before you get a new hip. Trust me, I have 2 new hips. I learned the hard way. Okay, now. Let's do it. Any tenderness here?
Yeah.
Here?
Yes.
So first rib and second rib. So let's do the first rib. Okay, not the clavicle. Go just above the clavicle with my fingertips. Remember, first 6 ribs are bucket handle. If they are ready to go and adjust and go into place, if it's their turn, they'll go right into place. If it's not their turn, they will not go into place. And you'll say, oh, did that hurt you? And they'll say, yeah, you hurt me. Oh, first rib set very nicely. Let's go just below the first rib now to the second rib. Now, left sternoclavicular joint is actually lower than the right. And still a little prominent, not bad. Head of the humeruses. She's actually rotated more anterior here and flatter over here. The reason she's flatter here is because she's got atrophy. For 4 years, these muscles haven't really worked. So now, Dr. Vetanze, what am I going to do? You're going to do some exercises. Because Wes, my physical therapist, is going to tell you how to do these and show you how to do them. So when you're back in Florida, you do them and you build this shoulder back up. But this shoulder it's ready to, look how icky, right? Mm-hmm. Big, strong shoulder. That's called disuse atrophy. But now she's going to start using it. Hands behind your neck, lock your fingers. Oh, you just love that, don't you?
I love that one.
All right, so that was hands behind the neck. I call it the tonic adjustment. Hands behind the neck, head has to be back. You can't have the patient's hands behind the head or you tear the ligamenti nuchae. Okay, you have to have it behind the neck. And then when you do that, you lean the patient into you and you're adjusting, okay, with your chest into the thoracic spine. You can actually be specific with your chest to adjust various ribs, whether right or left or in the middle. Okay, you get the knack for it once you start doing it. Okay, now, you know what? That just changed this, didn't it? Yeah, so now that particular treatment changed the position and the translation of the right. You're still a little bit here, a little bit anterior. You're even here, first rib, bouncy, nice. First rib, nice, right? Mm-hmm. Yeah, okay. You have one more thing that needs to be done here. On your back for me. 2 more, on your back. There's a little something going on in the right shoulder. Scoot down. Well, doctor, she can play on the left side. You know, have your x-rays, have your MRI, you got your symptoms, fine. Now lay down. I'm going to let your body heal itself. I'm not going to heal I'm going to fix you up so the pressure's off, the alignment is in, gravity is never going to be your friend, but at least it's not going to tear you up, and let your body heal itself. So, but I sensed a third or fourth rib here. So we do Dr. Heron's wonderful technique. All right, bring your shoulder back here. I got you. Go to sleep. Oh, how many more times can I adjust that area? Okay, 4th, 5th, and 6th rib area. Supine, the vertebra. Okay, I had her sit because of a rib rotation angle on the left. I come back here and I find something on the right. It's a rib angle and a rotation of the 4th and 5th rib on the right. Okay, it's there. I palpated it. Do I fix it? Well, if I don't, will that misalignment of the rib start the whole process of misalignment over again? Well, certainly not going to help it, correct? So I thought I would fix it because it was also affecting the position of the head of the humerus. I could, so if the rib's out of alignment, throwing the head of the humerus forward on the right, can that cause the whole process to go over with? To start over? Well, let's see. If the head of the humerus is right, it throws the other shoulder blade backwards. Here we go. Starts all over again. If this is how your mind works, and you can see this, then do it. Get somebody to do the chiropractic to you this way. I know there are millions of people using chiropractors. Okay, I know that. Demand the right type of treatment. Have it explained to you. Why are you doing this? What's your goal? There's a lot of goals in chiropractic offices, and there's many, many, many chiropractors that are very gifted. There's some much, much, much better than me. There's some chiropractors I know to come up like that and like, you're healed. Okay? Well, Jesus was that guy. But it's hard to get an appointment with him. Okay? So try to find somebody that does a little more, start with the feet and works up to the head. Now let's get the neck. Oh, we got to ditch your shoulder. She had an anterior right humerus. So I fixed the trouble in the T4, 5, 6, and rib area. I balanced out the shoulder girdle, so now it's real symmetrical and even. Now I can adjust the head of the humerus. Why didn't I adjust it before? Because the shoulder girdle was twisted, head of the humerus was already jammed probably to the coracoid process, a chromium process, I don't know, something. Because every time she'd move it would be pinching. But why would I adjust it then before I adjust its socket, the house where it lives? Now, I come up, external rotation, tap. It's a tap. It's a tap. You understand? Okay. Internal rotation. Oh, missed it. Internal rotation. No pain, right? Okay. I won't make you get up right now. I'll check your neck next. Okay? Brookie! All right. We get to the top. Mastoids. Perfectly balanced. Thank you, God. Okay? Left posterior C1. No pain there at all, is there?
Just a little bit, actually.
Oh, a little bit. All right. Hello, Rod Smith. How are you? Are you next? We just had a guest come in. The famous Rod Smith of NFL fame. Okay, right posterior occiput. Left posterior C1. Okay, balance. Okay, now anything?
No.
Okay, so she had a little left at C1. It wasn't palpating. It's so much better. Friday, it was so jammed at the base of the skull. I touched it, and she tried to hit me, and she didn't hit me today. Okay, now we look at the chin. And just such a pretty girl. Okay, but she had a crooked face. A little girl with a crooked smile. Because the C1 occiput then affects the temporomandibular joint. But now, anything? Anything? No temporomandibular joint. And you'll be happy with this, husband. Tip of the chin lined up perfectly with the tip of the nose. Left temporal bulge is gone. Man, the maxilla, even. Okay? We are done. Sit up for me. Okay? First of all, I want to thank you very much for taking the time to come and visit me. And I'm sorry it cost you less than you thought it would. I apologize. Okay? But it is what it is. Tell me about your experience with here.
With here, it's been, I don't want to say miraculous, but kind of. It's definitely been an answer to prayers. It's been a really long time with a lot of pain, and it seemed like whenever I saw other doctors, it was like it didn't hurt enough, because it like, well, it's not a broken bone, or you're not, you're living life. And so it just felt like super hopeless. I was kind of like in the in-between. And when I first emailed you, and you said, I think it's whatever you called it, I don't know.
Yeah.
But you said, I think it's this. And that was so huge that you just that there was a name for it, because everyone was like, oh, you hurt, here's pills. With no even attempt to find out what was wrong. So that was huge for me. So it's been awesome.
Well, let's just say thank you,
much.
Lord, huh?
Yeah.
Okay? Thank you, Lord, for everything.
Thank you.
Thank you for having her here. Thank you for the gift of chiropractic. Amen. All right,
Amen.
honey, give me that.
Thank you.
You're welcome.